Gaitrie.
Hi, Chandra.
So we've been working on the One Health, One Love Caribbean project, and it has been interesting.
Very.
Yes, you and I do a lot of work on communities, community-based natural resource management, and then we're asked to transcribe our skills to One Health, and it has been a journey, hasn't it? What has it been like for you?
Well, in the beginning it was very challenging, especially with getting things done. For example, the project we are implementing in Suriname has to do with aquaponics, and for us, you need to understand that system before you can go into the community to explain to them what this system is and how it works and what benefits they will have from this project. So we are now in this phase that we have set up the system, checking everything if it works well or not. So the next step is to have this workshop where we can explain to the community what the system is, how expensive or cheap it can be to purchase all the material for the system.
What is your project about overall?
Okay, the project is aquaponics, to promote aquaponics. This is a system where you grow fishes and also crops. So it's not one or the other, it's both. So what happened is that in Suriname we have these gold mining activities, and we have areas where the water is very polluted with mercury. So especially for those communities living within that area, it's, I think, very good to know that there is a opportunity to grow your own food, so it's safe, and also to grow fishes, and it don't has any mercury in it.
When you work with indigenous groups, you work with indigenous groups of people?
Yes, these are more the Maroon community living in the Port District, Brokopondo. So you have more Maroon communities.
Okay, well, I can't say my project. Our project in Jamaica is working with Maroon communities also.
Yeah.
We are working with the Scots Hall Maroons. This is a group of Maroons who live in a rural part of Jamaica. They had a problem in terms of their river being contaminated because you have farmers who farm on the banks of the rivers. Yes, and they put their pig farms right on the edge because it's convenient for them to clean the holding areas for the animals and to give the animals water. So what they had was their pig pens right on the edge of the river. But then in the last 2 years, in much of the Caribbean islands, I'm not sure if this is the case for Suriname, but we had a very severe drought for the last 2 years. And what had happened was that it resulted in conflict in the community where there was never conflict before, because the river actually dried up. And so what was never a problem before became a problem, because they are now all competing for the same water source for domestic use, as well as the area that the farmers were using for the pigs. And the community is downstream and the farmers are upstream. Yeah, so this became a big problem. So they asked us for help. So this to us was a classic case of One Health, where it is a health problem because the pig waste is polluting the river, and the community is striving to build ecotourism. They want persons to come in and learn about their heritage and also increase the economic activity in the community. But this, of course, having the pig farmers there was hindering this. So we have run, as part of the One Health Caribbean project, a workshop which was done recently, very successful. We had at least 60 persons from the community actually attending, and then we are now working towards the last part of our project, which is a song competition to engage young people who came to the workshop but didn't really attend, as we suspected they wouldn't. But we know that music is the lifeblood of people in the Caribbean. And so again, using this multidisciplinary approach, we have the One Health Jamaica Celebrity Patron, who is also the One Health Caribbean Celebrity Patron, Basie, who you know from TOK, and he is helping us with the song competition. He's going to be a judge in the competition, judging the songs based on, they're going to be singing about the importance of rivers. We also have Stephen Newland from the band Roots on the Ground, who's also going to serve as a judge at the competition. So we're hoping to excite the young people to get them involved. And again, the One Health approach of bringing in music, the arts, science, the veterinarians on our team, myself, the environmental scientist, we have a public health person on the team, but it's a way of really using a One Health approach to help communities to achieve their goals of ecotourism and sustainable development.
Okay. Yeah, so for us, it is a very nice project you guys are doing in Jamaica, and you can see that One Health approach that you have, collaboration with different stakeholders. So we have the same thing that with scientists, and we have other NGOs that we are trying to get support from to make this project to achieve the success of it. And especially what I want to say about the communities, we have an idea how we would like to implement this project, but the thing is they should be willing to do it as we would like to, but we are open to their suggestions, what will work better for them.
Yes.
So that is what we have to try to find out now. So we are in that stage, and especially for growing the crops, what kind of crops they prefer, what kind of fishes they prefer. So we have to take all of that in consideration before we can really implement this project.
Understandable, and I think that is a concept that maybe is a challenge, especially persons who do more clinical work, not in all cases, but some vets, some physicians, they're more used to the situation. They're in a clinical situation where they prescribe, this is what you're going to do and so on. Whereas a community-based approach is slightly different, where if you're implementing at the community level, as you say, it's very important, first of all, to find out the needs of the community, or else you end up implementing something that is totally ineffective or something that the community doesn't need.
So that's very important to know what do they need, what do they want, and not just pushing your
own agenda. Yeah, it's kind of different, I think, because a lot of, I think some of our team members in the process have learned and discovered, and the One Health Approaches project is about learning and discovering. Persons who are used to more of a top-down approach discovered that in terms of working with One Health, when it comes on to community-based approaches, top-down is not necessarily the most effective. So using this bottom-up approach where the community members, they own the project for themselves. It's their community. They're the ones who have to live with the things that happen. By listening to them, and they were the ones who told us music is a very vital part of the community. They have a lot of young people. So if we want the young people who are also pig farmers, and we met a few of them at the workshop, you have to do music, because they will not come. And we saw the same thing. They came and sat outside, but they never really came into the workshop. They're more interested in the music. They want to find out when is the song competition, how can they enter. So One Health again is about that integrated approach, not just looking at one sector, but looking at all the relevant parties. And when I say parties, all the parties including BC, all the members of the music industry, various sectors who can contribute to getting people to change behavior and practicing more healthy lifestyles.
And in that way, you can guarantee that the project will be successful.
Agree.